Welcome back to the Three Koi Fishes channel. Today, we're tackling a topic that sends shivers down the spine of many new parents, those strange and sometimes unsettling baby behaviors. I'm your host, Joy, and with me today are two amazing moms, Sophie, who's seen it all, and our lovely new mom, Jocelyn, who has an adorable 3-month-old son named Leo.
Thanks for having me, Joy. Leo he's a joy mostly, but sometimes he does things that make me do Google searches frantically at 3 a.m.
Oh, Jocelyn, we've all been there. Babies are wonderfully weird little creatures.
Exactly. So let's dive into 6 common weird baby behaviors and, more importantly, when new parents should actually be concerned. Sophie, let's start with the first one, erratic breathing patterns.
Yes. The newborn breathing can be quite alarming. They might take short, shallow breaths, followed by longer pauses, sometimes even up to 10-15 seconds. This is called periodic breathing and is actually quite common in young infants. Their respiratory system is still maturing.
Oh my gosh, Leo does that. Sometimes he just stops. My heart leaps into my throat every time. When should I actually worry?
The key is to observe. If his color remains normal, pink, he doesn't seem distressed, and he eventually starts breathing again on his own, it's likely just periodic breathing. However, if his skin turns blue, especially around the lips or face, if he seems to be struggling to breathe, is gasping, or if the pauses are consistently very long and accompanied by other concerning signs, that's definitely a reason to call your pediatrician immediately.
Great distinction, Sophie. Number 2 on our list, the Morrow reflex or the startle reflex. Jocelyn, have you experienced this one?
Oh yes, it's like he suddenly thinks he's falling. His arms and legs fly out and he looks so surprised and sometimes even cries. It's so dramatic. What's going on there?
The Morrow reflex is a primitive reflex that all newborns have. It's thought to be a survival mechanism from our primate ancestors. A sudden change in position, a loud noise, or even just a slight movement can trigger it. It usually disappears by around 3 to 6 months.
And when should this dramatic flailing raise a red flag?
If the reflex is absent on one side of the body, or if it persists beyond 6 months, it could indicate a neurological or physical issue and warrants a discussion with your doctor.
Moving on to number 3, eyes crossing or appearing misaligned. This can really worry new parents.
Leo's eyes definitely do that sometimes. One will look straight at me and the other will wander off. It looks so strange. Is he okay?
It's very common for newborns' eye muscles to be a bit uncoordinated in the first few months. Their eyes might cross or drift outwards occasionally. However, by around 3 to 4 months, their eye muscles should be strengthening, and their gaze should become more consistently aligned.
So, when should Jocelyn be concerned about Leo's wandering eyes?
If the misalignment is constant, if one eye is consistently turned in or out, or if you notice any rapid, jerky eye movements, anastagmus, after the first few months, it's important to have it checked by a pediatrician or a pediatric ophthalmologist.
Our 4th weird baby behavior is jerky movements, especially during sleep.
Oh, the little twitches. Sometimes Leo looks like he's having tiny little seizures when he's dozing. It's quite unsettling.
These are usually just myoclonic jerks, which are normal, involuntary muscle spasms in newborns. They're often seen during active sleep and are generally harmless. Think of it like your leg twitching sometimes when you're falling asleep.
And when do these little nighttime dances become a concern?
If the jerking is rhythmic, prolonged, or accompanied by other signs like stiffening of the body, changes in breathing or color, or if they seem to be happening while he's fully awake and alert, that would be a reason to seek medical advice.
Number 5 on our list of weirdness: hiccups and spitting up. These are practically a newborn rite of passage, but they can still be alarming.
Leo hiccups constantly and the spitting up. Sometimes it seems like he's bringing up his entire last meal. Is that normal?
Frequent hiccups are very common in babies. Their diaphragm is still developing and can be easily irritated. As for spitting up, as long as Leo is gaining weight well, seems comfortable, and the spit up isn't forceful or projectile, and doesn't contain blood or bile, it's usually just reflux, which is also very common in infants. Their digestive system is still immature.
So, when does the spitting and hiccuping become worrisome?
If the spitting up is projectile, happens after every feeding, contains blood or green bile, if Leo seems to be in pain or arching his back frequently after feeding, or if he's not gaining weight appropriately, those are all red flags. Similarly, persistent and severe hiccups that seem to cause distress should also be checked out.
Finally, number 6, grunting and straining, especially during bowel movements.
Oh, yes, the dramatic pooping sounds. Leo can sound like he's lifting weights when he's trying to go. It's quite the performance.
It is. Babies have immature abdominal muscles, so they often grunt and strain to help move things along. As long as their stools are soft and they are passing them regularly, this is usually normal.
And when should Jocelyn be concerned about Leo's vocal bowel movements?
If Leo seems to be in significant pain, if his abdomen is hard and distended, if he's not passing stools regularly, or if his stools are very hard or contain blood, those are reasons to contact your pediatrician.
This has been so helpful, Sophie. Jocelyn, do you feel a little more reassured?
Definitely. It's good to know what's within the realm of normal baby weirdness and what actually warrants a call to the doctor. It's so easy to get caught up in worry as a new parent.
Absolutely. Trust your instincts, Jocelyn. You know your baby best. And when in doubt, it's always better to err on the side of caution and reach out to your pediatrician.
That's wonderful advice, Sophie. Thank you both for this insightful conversation. Remember, new parents, you're doing an amazing job. Don't hesitate to seek support and information. Please remember to comment, like, and hit the subscribe button to show some love for our channel. See you in the next video.